Hello, I'm your host, once again, Dr. Festus Osai. You're welcome to your doctor and you. Have you ever wondered why a medical doctor, despite the dangers ahead of him, he still want to save life? Have you ever wondered, despite dangers of kind of form of insecurity, you imagine a doctor leaving his house at 2 a.m., hours in the morning, drives to the clinic just to save life? Or somebody comes in the road, something just happened, it takes him one to the theater, he's so tired, but you want to make sure he saves lives. Sometimes his child may not be feeling too well, so in the hospital, but they call him for an emergency. He say, let me go and rush and save that life. Maybe that one is more for an emergency than my own child. Or just imagine in this period of COVID-19 and the rest, you do know how many doctors died. Even other health workers died. But did doctors throw in the toil? They didn't. Despite the dangers, despite the uncertainty. Have you ever wondered why they decide to remain practicing, whether here in Nigeria or other part of the world? Is there something that's binding them to that practice? Have you ever wondered why? As a medical doctor all over the world, when we communicate, we can know who is a doctor or who is not a doctor by our simple communication for just 5 minutes. So if you think you're a quack, you come into the gathering of medical doctors, when they interact with you with some few minutes, they will know who you are. Is it by magic? Or rather, have you ever imagined why this one goes to another special categories of doctors where some doctors seem to be going upwards in terms of their practice, moving forward and upward, while some either stagnated or rather they closed down their facility in terms of private practice. Have you ever wondered why? Then I will explain to you. There are 3 P's I've been able to identify from my years of practice as a medical practitioner. There are 3 P's I've been able to identify that's encompassing in the life of a medical practitioner. 3 P's that tend to answer all these questions I've just asked previously. 3 P's. 1 P, 2nd P, and 3rd P. The first P is the passion of the practice. The 2nd P is the principles of the practice. And of course, the 3rd P is what? The prosperity of the practice. These 3 come into play to make you a doctor and to take you to the other level where you want to be a private doctor to get to certain level of height you intend to be. I'm your host, Dr. Festus Osai. And in your next clip, I'm going to explain to you the different P's so you understand it better and you'd rather be convinced or rather you want to make a comment about it. Thank you very much. Thanks for listening. Watch out for the next clip.